you for coming, especially in a short notice. And I just wanted to say, we just wanted to update our residents and your viewers what is going on in Fort Bend County when it comes to COVID-19 situation. As we all know, we have been talking about COVID maybe getting close to a year, and we are tired of it, but it looks like COVID is not tired of us. It is still here, alive and well. And so, and also, as I always said, I'm so proud of Fort Bend County because Fort Bend County residents responded to our orders, our guidelines very well, and we were able to work together because they care about their families, their neighbors, and also during stay-at-home order, and also following the mask orders and things of that nature in the past, they all came together and worked together to make Fort Bend County continue to be a safe and better place. And I'm so appreciative of that. But today we are talking about why we are here. The cases in Fort Bend County, not just Fort Bend County, in this region, in our state, in our country, is going up in a big number, actually big numbers, skyrocketing. Hospitalization is soaring. And also ICU bed usage is increasing in such a way it is alarming for the medical community. It is alarming for our Health and Human Services Department to see what is going on. And so today, because of all these specific situations, we wanted to, I always believe in transparency and communication with our community. And so I just wanted to say I am going to be elevating the threat level, COVID threat level in Fort Bend County from orange to red, which is the highest level. I just want you to know that I'm hoping, and I'm hoping and praying this is not for a long time. We need to do this maybe a short period of time, and then so that that help us to curb, flatten the curve, and that is the whole idea here. And also I wanted to reiterate that at this point there is no shutdown orders. This is actually a guideline for our citizens, and so that we all can work together, and especially holidays are upon us, and we just wanted to we all celebrate it safe, but at the same time taking enough precautions so that we all can be saving life. As county's top elected official, your county judge, it is my job, my #1 job is to protect our citizens, save life and protect our citizens. That's what we are trying to do by doing, elevating the threat level today. And so with that, I will invite our Health and Human Services Director, Dr. Jacqueline Minter, to give more details about the current situation. Dr. Minter?
Thank you, Judge George, and good afternoon, everyone. So 2 weeks ago, on November 24th, I spoke to our Commissioner's Court to update on the increasing trends of cases and test positivity and deaths in our county. And at that time, we were looking at approximately 20,000 deaths. 20,000 laboratory confirmed cases of COVID-19. And today, just 2 weeks later, we have surpassed 25,000 cases. And this means in just 2 weeks, 5,000 more of our citizens have been reported as infected with the virus. And has been stated many times before, what we are seeing now is reflective of behaviors that occurred 10 to 21 days prior. And the rate of growth in numbers represents widespread and uncontrolled transmission of the SARS-CoV-2 virus. So in addition to the numbers of infected persons, we've also experienced increased testing and increased test positivity. In months past, we had gotten down to about 3% test positivity. Now we're running anywhere between 9 and 13% at our testing sites and at our local hospitals. We've also reported more deaths. Some of these deaths have occurred weeks or months prior. Others have occurred more recently, but all of these have the potential to change the lives of those who love them that have been left behind. Our local hospitals continue to see an increase in the percentage of COVID patients that they are taking in. and an increase in the number of ICU bed patients, as the judge has said. However, the good news is that the collective measures that we have taken to mitigate COVID have been successful in low rates of flu transmission. So flu shots and masks and good hygiene, good hand hygiene have been critical in keeping the twin epidemics of flu and COVID-19 at a low level this fall and in the early winter. So this further demonstrates that our behavior does have consequences, both positive and unwanted. So another positive occurrence is that we have 2 vaccines. I know that you've been hearing about those in the news, but these 2 vaccines should be approved to be distributed in the coming weeks if the emergency use authorization is granted by the FDA. And as a result, for the first vaccine, the very first Fort Bend County residents could receive their vaccine as early as next week. Now, this vaccine is going to focus on those at high risk, those in the healthcare delivery system, those in hospitals and long-term care facilities, as well as EMS. Those will be the first ones to be offered the vaccine. But we also know that the general public will also have access to that vaccine in the coming 6 to 9 months. At that point, it will still be staged as to your risk. There is definitely light at the end of this tunnel. In the meantime, our immediate situation is not quite as bright. With the rapid spread of disease that we are experiencing in this holiday season, we've got to apply the knowledge and practices that have been successful in the past. We've got to acknowledge that we want to celebrate holidays, and we should. We need to make sure that we are keeping in touch with each other and that we are strengthening relationships. But we have to do this in safe ways. We have to assess our personal risk and those of our family members, our friends, our loved ones, and our coworkers. And we have to evaluate the risk of each activity that we engage in. Some activities are going to be much more risky than others. Now, we all know COVID fatigue is very real. We know it's prevalent among every one of us. And we still need to do these risk assessments and make wise choices. As tired as we all are of being apart from one another, of wearing these masks, and of thinking of every choice we make, we've got to continue to do these practices. If we fail to continue these practices, we're going to see the cases continue to increase. So we know you're tired. We're tired too. But being tired and stopping has its consequences. It's my sincere hope that by the judge raising this risk level, that we'll recommit to those behaviors that will be successful. And if we recommit today, December 9th, we hope that we'll ensure that we have a healthy and happier New Year on January 1st. Thank you.
Thank you, Dr. Minter. The bottom line is we need our citizens' help. And this is a fight. We are doing it together. And this is not a one-person fight. This is, we collectively do it. We found we were able to fight this effectively in the August, September timeframe. We masked up and we safe distanced and not attending, mass gathering and things of that nature. We were able to flatten and also bring down the positivity of COVID-19. And I have no doubt we will do it again. And so, again, with your help, what we are looking forward here is, as we did before, we need to do it again, mask up, safe distance, and no large gathering. And remember, COVID is here, it is real. And with that, we could ease the burden on our hospital system. And more importantly, we could protect our loved ones. We could save life in Fort Bend County. And I repeat again, my primary responsibility is to protect our citizens and save lives. And that's the reason why I'm coming in front of you, asking for your help with this. And if you're looking forward for any information, about COVID-19 situation, I encourage people to go to www.coronavirusfortbend.gov for more information. And if you have any question, you're welcome to reach out to our office or HHS department or Office of Emergency Management. And with that, I will invite Mark Flathouse, our Office of Emergency Management Coordinator, to brief us on the preparation they are taking. Mark?
Good afternoon. To follow what Dr. Minter and the county judge just mentioned, Homeland Security Emergency Management will be kind of upgrading throughout the holidays for our activation to make sure that we are pushing out the communication from HHS and from the judge's office, making sure that with our jurisdictions and our cities. We are also working with the cities right now, making sure that we provide them and help them with some PPE giving out to the citizens, and coordination between now and the end of the year as far as those. So if you live inside the cities, the jurisdictions, be on the lookout for that. We're trying to make sure that we get the right equipment out there and PPE for the people, making sure that people have it readily available, along with all the other programs at the county that we're putting out there. We want to make sure that we push that message over the next week or two while we're in this red category. So with that being said, Homeland Security Emergency Management, he stated a lot of, the judge stated a lot of different websites to go to. Same situation here. We can push the information out, we can share it, and we can also answer any questions that you have as we move forward. So thank you.
Thank you, Mark. Yes, I just want to repeat, Dr. Minter said there is hope in the horizon and a vaccine is on its way. But at the moment, right at this moment, what we have is safe distancing and wearing a mask and not attending any large gathering. This all we said again and again, this will help. And with that, if you have any question, we will open it up for that.
Yes, I'm KKRK pool camera for the rest of the other stations. I have some questions from KHOU. And Judge, either you or Dr. Minter can answer these, whoever feels more prone to do it.
Is this specific COVID related? Maybe I will refer to
yeah, sure. Let's have Dr. Minter step up there and we'll ask her. First question, Dr. Minter, is what do you believe caused Fort Bend County's average positivity rate to spike during the last month? What was the reason for that spike, do you believe?
So in interviewing the cases and the contacts over the past month, we noticed that people are gathering more. They're gathering more, they're talking about gathering with people, and close gatherings, not necessarily wearing their masks. Some of these are small gatherings, they're not necessarily big events. I think people have been pretty wise about some of the large events, but they've been having small gatherings, and the virus is very contagious. And when you're having small gatherings, the virus is going to spread from one person to the next, and they're going to come to work, and it's going to spread further. So we do believe that multiple small gatherings has been one of the main reasons, and then people being tired of wearing their masks and tired of being apart.
Do you think it's directly related to the Thanksgiving Day holiday as far as gatherings go?
So I think, honestly, it started before then. I absolutely think we are going to see Thanksgiving results in the next coming days and weeks, up to the next month.
Okay. Another question for you, Dr. Minter. You told Commissioners Court yesterday that a lot of people with COVID are ignoring their mild symptoms or mistaking them for some other illnesses. How widespread is that problem, and what impact is that having on helping stop the spread? So
I think that it's fairly widespread as when we are interviewing people, again, as I say, when our epidemiologists and when I myself am interviewing cases, and they discuss that they don't have any symptoms other than my normal allergies. So those symptoms are very, very similar to the same symptoms of COVID-19. So if they have congestion, they have sore throat, these are things that they may attribute to allergies in other seasons, but when we have a pandemic, they can certainly go along with COVID-19. And what I've said, and many of us have said over and over, you can have allergies and have COVID. So even if it's an allergy symptom, you could also have COVID along with it.
What advice would you give to Fort Bend County residents who still want to gather over the holidays and spend time together in a group? What advice do you have?
So I think there's a lot of advice, and I think that spending time together is important. Right now, we need for our mental and social health. We need to be making sure that we're checking in on people and having those relationships. We know that it's very difficult to go this long without having relationships. However, we have to do it safely. I think that there have been good guidelines out about how to do it safely, how to prepare to get people that are in your bubble, meaning a limited amount of people, 10 or less, or household people, and making sure that 14 days prior to getting together, that you have extremely limited contact with other people, that you test 5 to 7 days before, and that you make sure that even when you're together, you still practice great hygiene and physical distancing when you're able to.
Perfect. And one last question for the judge. And this is kind of a theoretical type of question. You're fighting this spread, and you've come before us many other times. Are you also fighting human nature aside from the spread? Do you find that that's an issue as well, that it's just people's human nature to gather and be together, not necessarily just neglect what they're being told? How tough is that battle, just fighting human nature?
It's a human nature, and also, we are very proud of being Americans, and we don't, we feel, that's what makes us, because we enjoy life and we get together and all that stuff. I really understand that. But we are dealing with something nobody else did in the past. And so this is actually, answer your question, I believe there is some of our mindset will play into that. And I personally see people who don't believe in any of the stuff we are talking about. But that is their personal thought. But I, as an elected official, and I wanted to, like I said, I repeat again, my job is to protect and save lives in Fort Bend County, and it is important for me to send this message to our citizens, saying that it is important to mask up, it is important to wash your hands often, and it is important not to participate in mass gatherings. And if you can avoid even smaller gatherings, if you can, avoid, and that is the best thing. And also, I will add, with along with Dr. Minter mentioned, we are relying on technology to get together and communicate with people. And I encourage people to do that kind of Zoom Christmas. I don't know how that looked like, but we are trying a lot of new things, and this is short term, in my opinion, and it is short term, maybe next 4 weeks, 6 weeks, 8 weeks, and it's not going to be a long term thing. So be patient with it. By then, of course, certain amount of a quantity of vaccine is going to be here, and so things will get better, and there is hope, absolutely hope, and I'm so confident things will be much better maybe a few months from now. But meantime, work with us, and let's all work together to make Fort Bend County a safer place for our citizens.
Quick question. We know your power is limited as a judge, but there was a mass gathering in the Katy area this weekend. What is your message to them?
So as you know, and there are specific orders from governor still in existence, so that's the very reason why we are not issuing any specific orders. And the message to them is very simple. I just repeat the same thing I said. And, be responsible, number one. And life is not just about you. It's more than that. We care about people around. That's what we are known for. We care about people around us. And maybe you have your elderly parents or your uncles or auntie or somebody at home, and you're putting them at risk. And also, like you're putting somebody else outside, you don't even know that you're putting them at risk. And I believe, I'm hoping and praying you're going to be responsible, and be responsible. Take all these precautions. That is the only tools we have right now until we get the vaccine. So my message is, please follow these guidelines so that we could save more life. We don't want to lose any life, because one life is too many lives to lose.
Judge, what position, what kind of level would you feel you would have to expand on this, and maybe have a possible either shut down the schools or something like that? Is that something that you feel like you can be facing at a certain point in time if the cases do continue to rise? See,
the thing about it is, one of the reasons we are making this announcement today, we don't want to get there. That's the reason why. We don't want to get there. And the last thing I want to do is shut down our schools or any organizations in our county, and we don't want to get there. That's why this is more like a precaution. We are telling people, and like I said, this is not an order. I mean, there is no orders are issued today. But
have you considered a curfew?
No, not at the moment. Not at the moment. But we are watching it very closely.
Have you checked on the hospital capacity? Do you feel like that the hospitals in the county are ready for a possible for the second wave of COVID? Do you feel like you are properly prepared?
See, we are always preparing ourselves the best of our ability, and we always continue to do that. We watch this on a daily basis, and we assess the threat. But at this point, we are looking at definitely this is the best thing we can communicate with our citizens. And I just wanted to say thank you for you all being here, and happy holidays, and be safe. Thank you. Thank you, sir.